Bharatiya Awards and Orations, and the President, Karnataka Sexual Science Academy. Sir, we welcome you, sir. Dr. George Reddy, sir, is a consultant psychiatrist at Healthy Brain Clinic and Hospital, Tirmalgiri, Hyderabad. Past consultant psychiatrist for NIMH Secunderabad. Past honorary consultant to World Health Organization in the field of rehabilitation. MBBS from Kakatiya Medical College, Warangal. DPM from Guntur Medical College. President of Indian Association of Private Psychiatric Society, Telangana. Treasurer of Telangana Private Psychiatric Hospital. Past President, Hyderabad Psychiatric Society. Founder and past honorary General Secretary, Indian Psychiatric Society, Telangana State. Honorary consultant to Missionaries of Charity, SPES Charity De-Addiction Clinic, Don Bosco Navajivan Home for Street Children, Sahayam Usmania Medical University. Area of interest are substance abuse and de-addiction, child psychiatry, rehabilitation, and liaison. Sir, we hand over to the chairpersons to introduce the speaker, sir.
Very much. Good morning to everybody, and I'm extremely happy that Dr. Nirmal Lamichhane is speaking on role of spirituality in practice of psychiatry. I know Dr. Nirmal Lamichhane for many years, and very, very personally remember all the hospitality he had extended when we were there at SAARC conferences, plus the Association of Psychiatrists of Nepal, two of the programs what I have attended. Pokhara is a very nice place, and he heads the Department of Psychiatry of Mental Health, Gandhiki Medical College, Pokhara, Nepal. He is the Vice President, Psychiatrists Association of Nepal. Formerly, he was also President of Honorary General Secretary of SAARC Psychiatric Federation. He has many scientific papers, presentations in national and international conferences and journals and books. His hobbies include movies, literature, advocacy of mental health in media. He is not only an exceptional professional, but he's also acted in Nepali and other regional languages. But more than anything else, very actively involved with research, advocacy, and one of the very area of interest, spirituality, is something which we would like to see how best this can be incorporated in our psychiatric practice. Dr. George Reddy, I think I'll request him to conclude, keeping in mind the limitation of time. Dr. Nirmal, please proceed.
Hello, is the screen visible now, sir?
Yes, yes, it is visible.
Okay. Thank you very much, sir, for that introduction. I always introduce myself. Am I audible, sir?
You are audible.
You're audible, sir, but you need to share your screen, sir.
How do you do that? How do I do that?
Sir, please open your PPT, sir. Dr. Nirmal, sir.
I have.
Yeah, you open your PPT, sir.
Yes.
Come back to Zoom, sir.
Yes.
Yeah, there will be share screen option, sir. Green button, sir. Share screen. At the bottom, sir. At the bottom, there will be share screen, sir. In the center, exactly in the center. If you press that share screen button,
okay, share screen, right.
now you can go to, yes, sir. Yeah. Please make it full screen, sir. Thank you, sir.
Thank you very much, sir. At the onset, I would like to thank the organizers and spirituality section of IPS for inviting me to be the speaker. I have certain disclaimers, actually. When Kishan sir first called me to be the speaker, I had told him upright that, sir, I am not an expert in spirituality. So told him that we'll discuss and we'll try to find someone who might be better for that. But eventually, everybody suggested that, okay, whatever, you be the speaker, and here I am. Hearing from all the speakers in the previous lectures, I find myself as a recruit in the field when all of them, the giants, were speaking. One thing what I have done is when I was
sorry to interrupt you, sir. Your voice is not clear, sir.
Now, sir?
Internet bandwidth is low. You can just stop your video and you can talk, sir. If the internet bandwidth is low.
Okay. Am I audible now?
Yeah, it is better, sir.
So what I did to prepare this presentation is I started searching in the Google and I had typed spirituality and mental health, and then spirituality and mental health in Nepal. And what I came out with has been already presented by the previous speakers. I was really surprised by the presentation of Professor Alan, how beautifully he has prepared his presentation and presented all that I had aspired to present. So all throughout this morning, I had been cutting out my slides so that I would not be repeating everything that previous speakers has already said. And also because we are already going late in the session, I'm sure the organizers have done a very good job and they must be tired before this is the session before the lunch. So I will not take longer time to finish my presentation. I promise you that. Talking about spirituality and mental health, as I said, I will not be going into detail of the importance of mental health and spirituality and the definition and all that sort. Like Dr. Gambhira said, before talking about spirituality, I think these two definitions of health by WHO and mental health by WHO is worth remembering. I think if we go into the essence of this definition, it already says that tell us the role of spirituality that it plays in mental well-being. And recently, we have been hearing a lot about spirituality and mental health, and globally also. And we all know the concept of spirituality involves belief and obedience related to God. So I think it's a kind of abstract way of searching for the meaning of life and a sense of connectedness to the universe. So when we reside in a country, Nepal, which is said to be blessed with a lot of giants, lot of great peoples in the field of spirituality. We know we have heard about Bhagavad Gita and its essence. We have heard about Buddhism and its essence. We are the land which belongs to the people who advocated that centuries, many years ago. So the role of spirituality, the connectedness of Nepal with spirituality there is no doubt about it. But as a mental health professional from the very beginning, I must admit to this gathering that we as a mental health professional need so much to do to reach up to the level of practicing spirituality for the benefit of mental health. What happens from Nepal, what I see is we are still in a state where we are striving to materialize the definition of health per se given by the WHO. And disease, and in that also we are concentrating on giving this the service for this disease or infirmity portion of the essence of health. So I believe that we as a mental health professionals, we need to collaborate, because we know that we are rich in spiritual practitioners, religious practitioners in Nepal, who are doing on their own, who are doing, some are doing it rightly or some are doing it wrongly, in whatever way. If we could collaborate, communicate with this religious and faith community and come together as an unit to give mental health services, to give the essence of spirituality and religious faith in the mental health practice in our day-to-day life. I think that is the big take-home message that we can gather from this whole conference from the morning. So without much ado, the take-home message from me would be the interrelationship between spirituality and mental health have been known for decades. It's not something new. We have seen it in Bhagavad Gita, in Tripitaka. We did not hear speakers talking about Bible and Quran this till now. Maybe professor from Pakistan, Professor Muhammad Iqbal, will be talking, probably talking about Quran. Every book, every religious book, every literature which talks about spirituality and religion talks about the essence of the essence which we know will help in better mental health, and it has been proven. We show some of the researches that has been conducted. Professor Mohandas, Mohandas, he talked about the researches that he had conducted regarding the neural correlate. So when positive thoughts and spirituality have a lot of positive benefits, why not think about spirituality in mental health? So, and unfortunately, we in Nepal, being a small community of mental health practitioners, we are still living in the magical world where we think that medicine will solve all the problems. So it is high time that we come out of this thinking, and we know this secret known to all us, the great secret of medicine known to doctors, but still hidden from the public, is that most things get better by themselves, which I think in essence tells us about non-pharmacological management of the various illnesses and its benefit. So what I see as a practitioner in Nepal is we all are blowing our own trumpets. Like we as a mental health professionals, we think that we know it all, and others, the spiritual practitioners, the religious practitioners, the faith healers, everybody think that they know everything. So it is high time we need to collaborate and cooperate and form a synchrony with those and give mental health, good mental health to the community. Thank you very much. Hello?
Yes. Dr. Nirmal, very
brief. Sir, I thought the organizers are very tired and it's getting late. They are waiting for the lunch, so I tried to be brief. I would be very much vocal if there is any question to me. I'm ready to answer any question.
Very brief, but effectively brought into the focus that in understanding psychopathology, in dealing with patients, the methods that could be followed have been brought out very clearly. I request Dr. George Reddy to see what are the questions there and to conclude the session effectively. Thank you very much.
Professor Nirmal sir, yeah, you're on your video, sir. I think before questions, sir, I thought I should take the Professor Nirmal sirs and Dr. T.S.S. Rao sir take. Sir, I think we postgraduates in psychiatry, we look at spirituality, might be as we age, as we become wise, I think like anybody, we start to look at spirituality and we try to incorporate in our daily practice. But what would be your take, sir, if a recently joined postgraduate or a young practitioner who looks at spirituality and mental health and helping in our patient daily care, sir? How would that be, sir? Teaching the role of spirituality for our students too, right from the early stage of their practice.
Right, sir. Okay. To answer that question, if you had followed the presentation of Professor Allen this morning, he had given the statement. I think WHO has put forward a certain a number of statements which will guide new or old practitioners as how we should be incorporating religious, ethical, and spiritual belief of the patient in the benefit of the patient's treatment. So that is clearly stated in that statement. I did not wanted to repeat it again because of constraint of time. In WHO's statement, if you go through that article, there is a clear guidance to all new and old practitioners. If we bring that into consideration, in fact, whenever I take a lecture of our undergraduate or postgraduate students, I tell them that it is high time that we come out of our biological therapy. We need to come out of the biological therapy, and we should start incorporating non-biological therapy as well for the benefit of our patients. That you should be doing from the very beginning of the practice. Sooner the better.
I'll also make one comment because George Reddy's statement was a little broader one for the chairman also. One of the analogy what I can give is what in financial circles they talk about. You have to plan your retirement when you are young. Same principle applies even for the spirituality also. So this is not something we should be dealt as a separate one, but it is part and parcel of our life planning, and this can help us grow very positively in a better way. This applies to postgraduates, it applies to everybody.
Sir. And at least, sir, after I know Dr. Kishan sir in depth, sir, and the kind of sense he uses for spirituality in his daily practice, at least I'm trying to incorporate some of the lessons or some of the things I read, sir. And do you think, sir, in that little time we try to help our patients, looking from the spirituality point of view, does it help the patient, whatever might be the diagnosis, sir? Would you feel that it would help them, sir?
Definitely. That is the problem we have in this part of the world. We are overburdened with patient. We have to treat the patient in limited period of time. That problem is there in I think in India, in Nepal, we are all facing the same problem. I say jokingly that when we see the patient, just give them goli now, and we'll see the rest of the thing goli. Goli is tomorrow in Nepal. Without we hurry to give the goli is medicine in Nepali. Okay, in Nepal, medicines are called to be goli. So give goli now, and we'll see the rest of the thing. Goli is tomorrow. Okay, that should not be the good practice should not be like that. We should now, with the growing number of psychiatrists in India and in Nepal, I think we should be more focusing on treating holistically. That holistical treatment thing has to come into focus. Otherwise, we will not be doing good, overall justice to our patients.
I think there was one comment from Dr. Manjula Devi. Ma'am is saying that spirituality preferably should come from childhood. It's not too early at all for postgraduates.
Yeah, that's correct. That's correct. It should, sooner the better. That's what she said.
Sir, with your permission, can I ask Dr. Professor T.S.S. Rao a question, sir?
Sure, sure. He's my guru.
Sir, does the role of spirituality and treating individuals with sexual issues related to mind, what would be your take, sir? How do you deal with linking spirituality and sexual issues, sir?
I think we need to differentiate spirituality from very narrow meaning of sometimes what we take about religion and various things like that. Spirituality is a very broad concept. See how we live comfortably and how we take things as it comes, and we believe in ourselves that there is some higher power which can take care of our responsibility. These concepts are applicable to any aspect of our growth and behavior or health for that matter. See, many of the times what happens, we try to take stress too much on ourselves. We don't share with others. We lack in communication. And we believe ourselves that highly individualistically we can handle the things. My take is spirituality is about communication, being comfortable with oneself and being true to oneself and believing in one of the higher order. So from that angle, sexuality problem, many of the times, if we try to look at, see, for all practical purposes, women's problems in general, and many of the men's problems, what we encounter, are related to the fact that they take it too seriously. That's where they land up in problem. So as we were trying to talk about spirituality, you start from childhood, early age, and then subsequently what we are talking about, maybe the crystallization properly happens as we age. The same true feeling applies even to the sexual issue. If somebody tries to control too many things in too big way and a restricted way, he tries to grow, more likely he is likely to land up with problems. I think I have tried in very brief to convey the message.
Thank you, sir. I think if there are, there is one question from Dr. Lakshman from Karimnagar. He asked, sir, what are the main methods to practice spirituality? Professor Nirmal, sir, there is one question.
Okay, sir. I had in the very beginning, in disclaimer, I have said that I am not an expert in spirituality. But in fact, I must thank these organizers that at least now I have known and I can probably do more justice to my patients from this knowledge, from this conference. So the question was again, please.
What are the main methods to practice spirituality?
I think I don't have answer to that. Professor T.S.S. Rao, yeah.
Very detailed list how one can go about. Methods may be too many. What is more comfortable for one has to actually take it up. Whether we are.
I think what WHO has published in that paper is very practical. It says that whatever spiritual belief or religious belief, ethical belief of that person is, we as a psychiatrist being non-judgmental may use that aspect of patient for the benefit of whatever illness the patient is having. I think that statement says like that. So I don't remember at the moment if there is any such guidelines.
Thank you, sir. I think, sir, with this, I hand over to Dr. T.S.S. Rao, sir. The questions are done, sir. Thank you, sir.
Thank you very much, Dr. George. And I must really thank Nirmal for bringing into focus that spirituality is one of the important component, whatever way we try to understand mental health or mental illnesses in general. There are multiple ways to actually look into this particular area. And everyone has its own way of handling life. If we can add a little bit of what we basically call the communication, relationship, faith, truthfulness, honesty, discipline, so one's life could be that much more better. I think that was actually one of the important message what Nirmal has conveyed. Personally, and on behalf of Dr. George Reddy, we thank the organizers for the wonderful opportunity you have provided for us to hear Dr. Nirmal, so also the whole of the program that is actually happening from home. Thank you very, very much.
Thank you, sir. From the organizing committee, we would like to send the digital memento to Dr. Nirmal Lamichhane, sir. Thank you for your words of wisdom, sir.
Thank you very much. Accepted.
Thank you, sir. We would like to give memento to our chairperson, Dr. TSS Rao, sir. Sir, kindly accept it, sir.
Thank you very much.
Thank you, sir. Sir, we would like our beloved Ram Subba Reddy, sir, to please give a memento to George Reddy, sir. Thank you, sir. From the organizing, we were going for a lunch break, a short lunch break. We would definitely be back by 1:45. Kindly log in by 1:45. Thank you.
Thank you.
ಡಾಕ್ಟರ್ ರಾವ್, ನೀವು ಕಳೆದ 25 ವರ್ಷ ಹಿಂದಿನ ಫೋಟೋ ಹಾಕೊಂಡಿದ್ದೀರಿ.
I don't want to grow up.
ತ್ರೇತಾಯುಗದ್ದು. ಸರಿ ಸರ್, ಆಲ್ ದಿ ಬೆಸ್ಟ್.
Thank you. Thank you so much.
TSS, how are you?
Oh, doing well, Harish Chandra. I sent some photograph to you. Did you see? Gambira Saab.
You joined from Mysore?
Nahi, Mandya house. I stay in Mandya. This is about 40 kilometers from Mysore.
Yeah?
Nice to see you. That so many things are happening in Sri Lanka.
We are going back to the 4 ages. Economic problems.
Mendis is there. I'm not able to see him. Dr. Mendis is also there in the screen.
Didn't they join?
I was wondering whether he's there.
Yeah.
He's there, na?
Yes.
Hello, sir. How are you?
क्या करना है ने? हरी okay. Then मैं TSS है वो को किलो है. हाँ? मानना चाहिए कितना है पे? Oh. Ya no, busy ka na, hindi conference secretary.